What is functional medicine? It can be difficult to define non-orthodox medical models, but they tend to have more things in common than characteristics that differentiate them. Importantly, the concepts of promoting balance and identifying underlying causes tend to be prominent. Non-orthodox medical models concentrate on chronic disease processes for one simple reason. No one disagrees with modern medicine's handling of acute conditions. These include medical emergencies such as accidents, acute life-threatening infections, and surgical emergencies. Hats off to the modern medical model. 6 to 12 years of training, predominantly in hospitals, makes doctors supremely well trained to deal with the acute medical problems. Where we struggle is in extrapolating this acute medical model into chronic diseases. Chronic disease, unlike acute disease, is about the slow and progressive overwhelming of cellular metabolic processes. It can take years, even decades, for these processes to finally break and trigger a recognizable disease state. At that point, medications and other expensive interventions can treat symptoms, restore functionality, and prolong life. But generally, curing the disease with these measures is difficult and not even proposed as a viable goal. Instead, chronic diseases are managed. Orthodox medicine almost exclusively employs therapies which are approved in a regulatory framework tailored to patentable, profitable interventions. Barriers to entry for other therapies are all but insurmountable. This is expensive or profitable, depending on which side of the ledger you are sitting on. But why wait until people have disease? Why not intervene on the imbalances before they become disease states, where small, targeted interventions can return cellular metabolism to normal and avoid the development of disease? By normalizing cellular function, we can prevent more than one condition at once. This is the true nature of individualized preventive medicine, something almost entirely ignored by the modern medical paradigm. Non-orthodox medical models consider the whole person and prioritize preventive health measures. They tend to avoid the segmentation of the body into unrelated systems, noticing the tight relationships between, for example, brain health, gut health, and the immune system. They address environmental toxicity from food, water, and air, and consider the negative consequences of technology and social changes as possible factors driving illness and disease. They have a keen focus on the gastrointestinal tract and consider issues like leaky gut and small intestinal bacterial overgrowth. They consider the liver and kidney as essential purification organs for bodies bombarded by environmental toxins. Orthodox medicine has one other weakness that is hard to ignore. It is inextricably bound to industry at all levels. Simply put, the interests of industry do not align with the interests of individuals, and industry spends billions in an organized, targeted fashion to ensure its interests prevail. Until medicine faces this real and potent conflict of interest, it will struggle to reach its full potential. Functional medicine, therefore, is a medical system that focuses on the function of cells, tissues, and organs, and tries to correct or preserve these functions when they face stress or fail. Anti-aging medicine addresses the cellular processes that drive aging and the diseases of aging, while regenerative medicine encompasses the interventions that seek to replace these functions when, due to age or disease, they are no longer salvageable. Functional, anti-aging, and regenerative medicine, or FAARM, if you ask me. It even has a nice ring to it. A medical model fit to confront the chronic disease epidemic.